Hello, this part will deal about the fetus, fetal hemoglobin, and the fetal disorders associated with certain drugs, etc. So, coming to fetal hematopoiesis, what is hematopoiesis? Formation of the blood cells is known as hematopoiesis, and until 6 weeks, the main site of hematopoiesis is the yolk sac, and the main hemoglobin is Portland hemoglobin, Gower 1, and Gower 2. After 6 weeks, liver or the spleen, mainly the liver, is the main site of hematopoiesis, and HbF, which has two alpha chains and two gamma chains, is the main hemoglobin. After 20 weeks, bone marrow is the site of hematopoiesis, and the main hemoglobin is HbA. Now, coming to fetal hemoglobin is made by the two chains, that is two alpha and two gamma chains. It has more oxygen carrying capacity or the more oxygen affinity than HbA. Oxygen dissociation curves lies to the left of the maternal curve. It has reduced level of 2,3-DPG and low carbonic anhydrase activity. It is resistant to acids and alkali, and this property is used in KB test. Now at the time of birth, the percentage of HbF is 75 to 80%. For newborn, hemoglobin is 16 to 18 grams per deciliter. After 6 months of birth, HbF reduced to less than 1%. So at birth, HbF is 75 to 80%, and after 6 months, HbF level falls to less than 1%. Now, fetal RBC. The cardiac output of the fetus is around 350 ml per kg per minute, while for the newborn it is more, that is 50 kilograms per minute. 500 ml per kg per minute. This is wrong. Ml per kg per minute. So the two tests based on HbF characteristics, resistance to acid and alkali. First is KB test and another is singles alkali denaturation test. This singles alkali denaturation test, also known as the AP test, is a qualitative test. So alkali means more L means qualitative. It is used to differentiate vasa previa from the placenta previa, and the reagent used is 1% KOH or sodium hydroxide. While in KB test or the Cleors-Batke test, it is acid evolution test. It is quantitative test. Batke means quantitative. It is used to calculate the dose of entity in Rh negative females, and the reagent used in Cleors-Batke test is the citric acid phosphate buffer. So these two tests are very important. Now coming to fetal circulation. So look at this graph. Yes. The site of oxygenation is placenta and not the lungs in the fetus. So it starts. So look at this. Yes. So we have umbilical vein. So as we all know that arteries are two arteries and one vein. And which vein is there in umbilical vein? Left umbilical vein is left after delivery. So the umbilical veins carries oxygen with 80% saturation. This umbilical vein carries blood to the ductus venosus and the liver via portal sinus. So the maximum blood is transported to the ductus venosus, while around 8 to 10% blood directly goes to the liver via the portal sinus. This ductus venosus carries oxygenated blood, while this liver carries 10% blood of umbilical vein, which is oxygenated, plus deoxygenated blood from the lower limbs and the liver. This blood goes to inferior vena cava such that oxygenated and deoxygenated bloods are mixed, and this inferior vena cava goes to the right atrium, then left atrium, left ventricle, and then aorta. So we all know that we have a foramen known as foramen ovale, through which the blood from right atrium goes to the left atrium, then left ventricle, and then aorta. And also this right atrium blood goes to the right ventricle via tricuspid valve, and then to the pulmonary artery. In pulmonary artery, 90% blood goes to the ductus arteriosus and then in the aorta, while 10% blood goes to the lungs, which is going back again to the left atrium via pulmonary vein. So aorta now carries the blood to the systemic circulation, and then the blood is returned to the umbilical artery, which carries deoxygenated blood, and then the placenta. And in this way, this fetal circulation occurs. Now, fetal breathing movements starts at 11 weeks, so the breathing starts at around 11 weeks. Fetal swallowing movements occurs at 10 to 12 weeks. Fetal urine production occurs at 8 to 11 weeks, definitely by the 12 weeks. Meconium production can happen after 16 weeks. Fetal limb movement can be perceived by 7 weeks, but quickening is different, which is the perception of fetal movements. It occurs in 16 to 18 weeks in primigravida, and 18 to 20 weeks in primigravida, and 16 to 18 weeks in the multigravida. Now coming to fetal cardiac activity. Fetal cardiac activity appears by 5 weeks in trans vaginal ultrasound, and 3 weeks after fertilization or day 21 of the fertilization. Surfactant production begins by 20 weeks, and the surfactant seen in the amniotic fluid by 28 weeks. So it takes around 8 weeks for the surfactant to appear in amniotic fluid. So these weeks are important for exam point of view. Now the fetal gonads develop by 7 weeks. Testes develop, T for testes develop earlier than ovaries. That is, male organ system, male genital organ system develops earlier than female genital system. 7 weeks for testes and 8 weeks for ovaries. Internal genitalia takes around 10 weeks to develop. External genitalia 12 weeks. It is formed earlier in females. So external genitalia is in females forms earlier than male external genitalia. Hormone production, urine production occurs by 12 weeks. HPA axis and insulin formation occurs by 12 weeks, while glucagon synthesis occurs by 8 weeks. Now there are some fetal lung maturity tests which are important in preterm labor to know about the maturity of the lungs, and the test is done in amniotic fluid, which is taken out by amniocentesis. Amniocentesis is done in 3rd trimester. So what are these tests? First one is LS ratio. LS ratio is lecithin to sphingomyelin ratio, and it is the most common test. If lecithin is more, then lungs are mature, and if lecithin is less, then lungs are not mature. So a ratio of 2 is taken. LS ratio more than 2 means lungs have matured, while LS ratio less than 2 is lungs not matured. Now there is one glycerol known as phosphatidylglycerol in amniotic fluid. It is the most common. LS ratio is the most common test, while phosphatidylglycerol levels in the amniotic fluid is the best and the most specific test. So if phosphatidylglycerol is present in amniotic fluid, then maturity of lungs can be ascertained, while if absent, then lungs are not mature. Then there is LBC. LBC is not liquid based cytology. It is LBC, lamellar body count. This is the storage form of surfactant, and if it is more than 50 K per microliter, it is a matured lung. 5 to 50 indicates undeterminate, and less than 50 means not mature. Then there are certain tests like shake or bubble test or Clement test, Nile blue sulfatase test, phosphatidylcholine test, and optical density test. So shake test and bubble test or Clement test is outdated, in which we take a test tube and mix alcohol and the amniotic fluid and then shake it. If bubbles are formed, then lungs are mature, and if not, then lungs are not mature. Then coming to Nile blue sulfate test, in which Nile blue sulfate dye is added to the amniotic fluid, and if color changes to orange, then it is matured lung. So if more than 50% cells are orange, then lungs are matured, and skin cells without phospholipid remains blue in color. So what is the principle of this test, Nile blue sulfate test? The principle is fetal skin cells are present in the amniotic fluid, and if phospholipid is present in the skin cells, phospholipid will also be present in the fetal lungs, hence lungs are mature. Now we can also check for phosphatidylcholine test and optical density test, and if phosphatidylcholine levels are more than 500 nanogram per ml in amniotic fluid and the optical density is more, that is 0.15 at 650 nanometers, then it is a mature lung. So this is the basis of Nile blue sulfate test. It is not a skin maturity test, but a test to use to assess the fetal lung maturity. Skin cells are present if the fetal lungs are mature and there is presence of phospholipids in the skin cells. So they will stain with Nile blue sulfate dye and will turn the color to orange, and if it remains blue in color, then the lungs are not mature. So these are the mature fetal skin cells with phospholipids, and the blue color cells are the skin cells without phospholipid.